A very good day, everyone. Today, I'm going to discuss an article with the title of A Systematic Review of Natural Language Processing Applied to Radiology Reports. This article is from BMC Medical Information Decision Making. And this article is a systematic review of publications using NLP on radiology reports from 2015 to October 2019. And it also highlights the growth in the field, the types of data used, the methods employed, as well as provides idea for future research. And the input data for these studies reviewed from generally comes from a variety of sources. For like medical institutions, the majority of the studies source data from single medical institution, leading to a potential issues with model generalizability due to overfitting. And we have publicly available data sets like Redcore and Stride. So these data sets are often used due to their accessibility and comprehensive nature. And the last one is electronic health records, which includes clinical notes and pathology reports. 164 reports has been used as the input data in this research. And this is the process, and this process includes feature extraction, where segmentation, boundary detection, word normalization, synthetic analysis, semantic analysis, and negotiation detection has been involved. And we have feature processing for collection of NLP features, and system task, which is report classification and information extraction, and then performance evaluation, and the last one is implementation. The review categorized the studies by year of publication, imaging modality, or anatomical region, uh, disease area, and the dataset sizes. So the CT scan were the most common imaging modality used in the studies, followed by MRI, X-ray, mammogram, and ultrasound. And it also details the NLP techniques used in the studies, including machine learning algorithms, information extraction methods, and document classification approaches. It also reports the performance matrices for these techniques, highlighting the best reported results in terms of recall, F1 score, and precision. So out of 4,836 initially identified publications, 164 studies met their inclusion criteria right after their review processes. And many studies reported high precision and recall values has the strong performance in specific tasks like disease classification and information extraction. And the use of pre-trained models and embedding has increased, but the traditional features like feature engineering approach remains prevalent in some cases. And these are the proposed ideas. And the first one will be enhanced data sharing and access. Facilitate data sharing across multiple institutions to create more comprehensive data sets. Data from single institution may cause model to overfit and not generalize well. And these multi-institutional data sets can improve the robustness and generalizability of NLP models. And the next one will be explainability and interpretability of deep learning models. Focus on more improving the interpretability of deep learning models to make them more suitable for clinical applications. So clinicians need to be more understandable the basis of model predictions to trust and effectively use them. Deep learning models, while powerful, are often seen as black boxes. And we have medical lexical knowledge, where enhanced deep learning models with external medical lexical knowledge and ontologies. Integrating domain-specific knowledge can improve the model performance and reduce bias, aiding in a better concept normalization and understanding of medical terminology. And the fourth one is addressing practical challenges. Focus on solving practical issues like data privacy, ethical consideration, and computational costs associated with deep learning. Overcoming this type of barriers is essential for broader adoption and deployment of NLP models in healthcare settings. And the last one is clinical collaboration. Foster close collaboration between NLP researchers and clinicians to ensure that developed solutions address real-world clinical needs and trial in clinical settings. So collaboration ensures that NLP models are relevant to clinical workflows and can be practically implemented, enhancing their impact on patient care. And the next one will be justification. So the first one will be data scarcity. Deep learning models require a large amount of data, which is often not available, but making traditional methods or hybrid approaches more practical in some cases. And the next one is interpretability, where the complexity of deep learning models make them less interpretable, which is a critical issue for clinical adoptions. And the third one is clinical relevance, where radiology reports are critical for medical diagnosis and treatment planning. And the last one is reproducibility. Lack of detailed reporting and availability of data and code hampers the ability to reproduce and validate finding across different research labs. And that's all from me. Thank you.